As students head back to school, the CDC is releasing new guidelines for administrators on the use of face coverings. Among the recommendations, who can and cannot wear a mask, and the importance of school leaders to have a plan when a student refuses to wear one. The CDC also says stigma, discrimination, or bullying could be an unforeseen consequence when it comes to masks. Joining us now with more is Dr. Catherine Drew, the CEO of Florida Psychological Associates. Dr. Drew, thank you so much for talking with us this morning.
Thank you for having me.
What can be done to combat this stigma, the discrimination, and the bullying that might arise because of face coverings and masks?
When children return to school, we need to make sure there are specific and attainable guidelines that are set up at the school level and enforced across the board at the school level, just like dress code. That way, the teachers and the parents can support those guidelines and also make exceptions as necessary. The teachers and the parents can also serve as an example, so demonstrating consistency wearing their mask and following the rules, as well as showing flexibility and tolerance.
Well, you know, we've all encountered folks across the country who, for whatever reason, cannot wear a mask, and they speak as adults about their experience when it comes to being bullied for not wearing a mask. What can be done to address bullying of children who cannot wear masks for medical reasons?
Well, we know that it is important for the parents to connect with the school as soon as possible and work together, because the evidence-based approach to combat bullying is actually not primarily targeted on the child. It's targeted on adult supervision. So when we work together and look at the environment that the bullying may be happening, we're able to implement new interventions or possibly redirect or even implement positive interventions to encourage the behavior that we do want in the classroom.
Bringing it back to the adult, bringing it back to the parent. As a parent, what can they do if their child is being bullied and if or their child is the one doing the bullying?
The parent should reach out to the school as soon as possible. Everyone is stressed right now, especially school personnel. So to reach out in a supportive way, maybe using this segment to start the conversation, and then work with the school on what may be able to be implemented differently or in addition in the classroom.
I know we have several districts starting school tomorrow throughout the region or later this week. Is there anything parents can do right now? Is there anything students can do right now to get prepared and be ahead of that bullying if it might occur?
Absolutely. So prevention is our best tool. To sit down with your children, preferably at the end of the day when all the cell phones are away, maybe around the dinner table, and talk with them about why some classmates may be super cautious about a face mask or worried. Maybe they have a grandparent at home who's medically vulnerable. Also, there could be other classmates who aren't wearing them at all, and discussing that could be because of skin conditions or sensory issues related to autism.
Yeah, this was a discussion we were having in the newsroom before the show started this morning, and we were talking about that. And, you know, bullying when it comes to masks, it appears it could almost go a couple different ways. You know, in some aspects, maybe it's hiding braces or something, and maybe that child who was bullied maybe won't be bullied. But then we were also talking about children who wear certain masks might be bullied because of what the masks look like.
Yeah, we know within the mental health community that anytime someone looks different, there's an opportunity for them to be bullied. And so what we do is we work with the students who may look different as well as the students who tend to blend in more, and work on ways that we can have tolerance for each other and be good humans.
It's all about being kind, right?
Yeah.
Well, we thank you so much. If there's anyone that wants to get in touch with you who might be watching right now, is there a way they can do so?
Yes, 904-277-0027 or floridapsychology.com.
Awesome, and of course we put all of this information on our website, newsforjax.com.
Thank you.
Dr. Drew, thank you so much.
Thank you.